focused on the 4 anaerobic bacteria: Clostridioides C. difficile, Clostridium, Bacteroides, Fusobacterium, and Actinomyces israelia. Using the mnemonic, anaerobes can't breathe fresh air. Clostridium, B. Acteroides, Fusobacterium, Actinomyces. Anaerobes are normal in GI, cause foul-smelling infections, gas production, and are resistant to aminoglycosides, require O2 to enter bacteria. Question 1, C. difficile, antibiotic-associated diarrhea. A 56-year-old woman develops profuse watery diarrhea after completing a 10-day course of clindamycin for cellulitis. Colonoscopy shows pseudomembranous colitis. Which of the following is the most appropriate treatment? A. Metronidazole, B. Vancomycin oral, C. Vancomycin IV, TMP-SMX, E. Erythromycin. Correct answer, B. Vancomycin oral. Why? Clostridioides difficile is an anaerobic spore-forming bacterium that causes pseudomembranous colitis. Oral vancomycin or fidaxomicin is preferred. A. Metronidazole is second line. C. IV vancomycin doesn't reach gut lumen. D. E. Ineffective against C. difficile. Question 2. Clostridium perfringens gas gangrene. A diabetic patient presents with sudden onset of crepitus, intense pain, and swelling in his leg after stepping on a nail. Tissue biopsy reveals gram-positive rods with no leukocytes. What is the most appropriate next step in management? A. IND only. B. Amoxicillin clavulinate. C. IV clindamycin and penicillin plus surgical debridement. D. TMP-SMX. E. IV vancomycin. Correct answer, C. IV clindamycin and penicillin plus surgical debridement. Why? Clostridium perfringens causes gas gangrene, myonecrosis, characterized by CO2H2 gas in tissues. Requires surgery plus anaerobic covamycin penicillin. A. Insufficient alone. B. D. Poor anaerobic coverage. E. Not first line for anaerobes. Question 3. Bacteroides fragilis, intra-abdominal abscess. A 44-year-old man undergoes bowel surgery and develops fever and abdominal pain post-op. Imaging reveals an intra-abdominal abscess. Culture reveals gram-negative anaerobes. What antibiotic combination is most appropriate? A. Vancomycin plus gentamicin. B. Ceftriaxone doxycycline. C. Metronidazole plus ceftriaxone. D. Azithromycin TMP-SMX. E. Meropenem only. Correct answer, C. Metronidazole plus ceftriaxone. Why? Bacteroides fragilis, a gram-negative anaerobe, is common in GI tract abscesses. Treated with metronidazole anaerobes plus ceftriaxone gram-negatives. A. Vancomycin not needed. B. No anaerobic coverage. E. Meropenem. Okay, but combination is often preferred. Question 4. Actinomyces israelii, jaw mass. A 55-year-old man presents with a firm, painless jaw mass that has slowly enlarged over months and now drains sulfur granules. Gram stain reveals branching filamentous gram-positive rods. What is the most likely pathogen and appropriate treatment? A. Nocardia, TMP-SMX. B. Actinomyces, penicillin. C. Mycobacterium, rifampin plus isoniazid. D. Staphylococcus, vancomycin. E. Fusobacterium. Metronidazole, correct answer. B. Actinomyces, penicillin. Why? Actinomyces israelii causes chronic cervicofacial abscesses with sulfur granules. It is a gram-positive anaerobe and treated with penicillin for prolonged duration. A. Nocardia is aerobic. C. For TB. D. Wrong bug. E. Fusobacterium doesn't cause sulfur granules. Question 5. Fusobacterium Lemierre syndrome. A 17-year-old boy develops fever, sore throat, and swelling on the side of the neck. Imaging reveals a thrombosed internal jugular vein. Blood cultures grow anaerobic gram-negative rods. What is the most likely pathogen and appropriate treatment? A. Streptococcus pyogenes, amoxicillin. B. Fusobacterium necrophorum. C. Staphylococcus aureus, vancomycin. D. Actinomyces, penicillin. E. Pseudomonas piperacillin tazobactam. Correct answer, B. Fusobacterium necrophorum, ampicillin sulbactam. Why? Fusobacterium necrophorum causes Lemierre syndrome, septic thrombophlebitis of the jugular vein following pharyngitis. Treat with anaerobic coverage, beta-lactam plus beta-lactamase inhibitor. A. C. Wrong organism. D. Wrong syndrome. E. No specific anaerobic coverage. Would you like